Hello, so my name's Ewan. I'm autistic and I'm also one of the psychologists in the Trust's autism service. So my job in the hospital is almost assessing children and young people to see if they are autistic. But what I'd like to talk to you today a bit more about is like what autism is and what that means during this week, which is World Autism Acceptance Week, and almost how that's changed over the period of time that this is something that I've been kind of working in, as well as it being kind of my own lived experience. So I first started working supporting autistic people 20 years ago, and since then we've seen a 700 to 800% increase in autism. In England at the moment, we'd expect between 1 in 100 and 1 in 75 people to be autistic. And I think that's probably mirrored in kind of what we might see amongst some of our colleagues here in the sort of health professions. A recent GP survey showed that for general practitioners, about 1 in 100 of them identified as being autistic. So what is autism, and what can that mean in terms of the title of the week being Autism Acceptance Week? So I guess autism is what we would say is a neurodevelopmental experience. That means it's part of who somebody is from kind of when they're born, and we know that there's some sort of genetic and environmental factors influence whether or not somebody will be autistic. But what that means in terms of the language that we use when we talk about autism is that for somebody who is autistic, that they prefer to be thought of as they are autistic rather than they have autism. It's something that is intrinsic to who we are. It's not something that we can separate out from that. And if we have a think about what autism is, traditionally autism has been defined and from a more sort of medical perspective, which sees it as a deficit in a number of areas, a deficit in social skills, a deficit in communication skills, and difficulties in maybe people who choose to sort of move differently or experience the sensory aspects of the world in a different way. But whether we see autism as a deficit is really based on kind of the environment that somebody finds themselves in, and to be accepting of those of us who are autistic, what I'd ask that you do is that you bear in mind what might be more challenging for your autistic colleagues about kind of being at work or being around other people, and that to allow those of us who are autistic to thrive and to be able to share our skills and our insights and things with you, and to be able to engage with you. There's a few things that might be helpful to know a bit about. So the first thing to say is autism is a very kind of individual experience. If you've met one person with autism, you've met one person with autism. We're all very kind of unique and different. One of the questions I'm often asked after conferring a diagnosis of autism by parents is, where is my child on the spectrum? Autism is traditionally described as or thought of as a spectrum condition. And the implication of that is to give the idea that everybody is kind of unique and different on there. But some people interpret that as like a ladder or a grade of being more autistic to less autistic. So what would be better to think about is that autism is more challenging for somebody to manage if the environment around them makes that harder for them. So what might make it easier for somebody with autism as one of your colleagues? So for those of us who are autistic, there's a common misconception that we maybe have less empathy, but many people with autism actually have a great deal of empathy, and they feel that really quite acutely, and that sense of wanting to do the right thing leads us to maybe put in an awful lot more effort to trying to fit in with other people around us. But fitting into other people around us doesn't necessarily come as easily or naturally to us. So we have to put a lot more effort into holding somebody's gaze or knowing what the right response might be if somebody's trying to be friendly or sociable. But there's lots of skills that we have that we might be able to bring to other people, that people who are autistic often have a greater eye for detail. They have a more original way of seeing or solving problems, but they maybe need a bit more space to be themselves. So what I would ask you to do is that if you do have a colleague who's autistic, to get to know them for who they are, ask them what helps, what might not help. So for me, I find talking to people one-to-one easier than talking in a big group. But I would encourage you just to ask your colleagues, if they are autistic, what would help for them. But just to say, there's a number of areas where you can maybe look for information or support if you think you might be autistic. There's a new Facebook group called Autistic Doctors International, and there's a number of letters being published in things like the journals for the Royal College of Psychiatrists or the British Psychological Society, for us, letting people know that we're here as your colleagues and we're happy to help contribute and to use our skills to further everything that we do. So that's me finished, and thank you for listening today.